I'm an injury epidemiologist. I work at the George Institute for Global Health. My research focuses on prevention of injury, from fall injury in older people to road injury to global health. I've got a large program of research in Aboriginal health. Injury is the leading cause of death and disability in children and young people globally, so it's a major issue. It's also an issue for Aboriginal populations. I do clinical trials where we understand the best, most effective treatment for when people sustain injuries, to help them manage their conditions and ensure the best outcomes. But I have a large program of research that looks at prevention, making sure people don't actually have injuries and that they can live healthy, productive lives. Falls, road traffic injuries, burns and drowning. Most of the work that I do is in the area of unintentional injury. Of course, suicide in young Aboriginal people is a major problem in Australia, and we need investment in research to address strategies to prevent that. The George Institute does research into the major causes of death and disability globally, which is chronic diseases and injuries. So we do work in looking at healthy ageing, neurological diseases, back pain. We have work in food policy so that people can make good choices about healthy food. We have a large program of research in stroke and cardiovascular medicine, as well as critical care and trauma. I went into medical research because I wanted to make a difference. I was working as a clinician on patients one-on-one, and I really wanted to actually get out there and say, I want to do things that are going to make a difference at a population level. I went into medical research to help understand the kind of conditions that cause, that are the major contributors to death and disability, and to look at ways in which we can prevent and treat them. But it was really because I was driven to make a difference. We're very good at doing implementation research, where we take the results of clinical trials and put them out there into practice and test them in real life. However, it's somewhere that we really need to continue to invest. We've got a long way to go. It's all very well doing lots of lab-based studies and clinical trials, but it's actually taking them out into the real world and actually testing them on real populations that's actually going to make the difference. Getting the clinical research out of the hospitals into the population and seeing what works.